My name is JoeyLynn Nolan, and I am the study manager for End Clinic at CHOP. And this is Katie Angione, who is a genetic counselor at Children's Hospital of Colorado. We're going to talk about today is the Syngap Promise study and the natural history study at CHOP and Children's Hospital of Colorado. And so the Syngap 1 natural history study, we want to learn about what it is, why it's important, and it's the medical research study that takes place in the clinical arm of the Center for collecting data to go forward for clinical trial readiness. And so what we will do is collect detailed information about the development, the symptoms, the experiences of our patients with Syngap and their families. We see people with Syngap of all ages and varying degrees of severity. So we want to enroll as many people as possible into our study. We get a lot of questions like, my child may not have seizures, or are they too old? There's no age limit and there's no severity limit. Like, we really can learn the most about this disorder if we can see as many people as possible. So that's why it's so important to enroll in this study. And the goal, of course, is to improve the prognosis, find treatments, and just improve quality of life for our families. And so some of this presentation is just going to be your kids because we love them and they're very cute. But what is Syngap Promise? Why do we need it? And how will it help? So basically, Syngap Promise is a prospective, multidisciplinary, multi-site study for clinical excellence. It's going to take me some time to get this acronym down. But we realize that really Syngap needs its own protocol. It has its own features. It's very important to study the disorder over time and the specific features that we're seeing. And what we learn as we see more and more patients with Syngap is that there are different issues that you all face, such as sleep and behavior. I don't have to preach to this room about that, but we know how important and how affected, it is. And then just some demographics, race, age, sex, and ethnicity of our patients. This will show you what it always shows you, that we need to increase diversity, of course, in our study. We need to also widen the age bracket and see as many different ages as possible. The older patients with Syngap they give us so much information, so many years of detailed knowledge that is so useful for our study, as well as our children that we see early because we get started at the beginning. We have a pretty even split with sex, which is great. And again, we just need to always work on including people of all different cultures, races, and ethnicities. And a shout out to Vicky, who also helps us champion this effort. Again, more cute pictures, but this is really what it's all about. It's the geographic distribution. We see people from all over, of course, because CHOP is on the East Coast. We see a lot of people from the East Coast, but we do have a lot of people come from the West Coast. Adding additional sites for Syngap Promise is going to be super beneficial for those that have a difficult time traveling to us, which is very understandable. I didn't put it in here and mention it, but I was a rare parent myself. And although I lost my son at 7 months old, I can empathize so much with the beginning of your journeys. But then I can just imagine the airplane rides and the car and the difficult way to get to us, and how that is just no small ask and no small feat, but it's so important. And I know you guys know that. And the beautiful thing about coming to clinic is when the families meet each other. It's our favorite part. And that's what the pictures that, we like to show is some Syngap dads bonding in the corner. But so, yeah, so we're going to, adding on sites will be helpful, but you guys are amazing. Your community is amazing. Why should you enroll? So our structure is multidisciplinary, which means you're going to see people from different specialties. You're going to see a pediatric neurologist, a genetic counselor, occupational therapy, physical therapy, a nurse practitioner that specializes in not only epilepsy, but keto. And we've just added on speech therapy, which is a big development for CHOP's End Clinic. And I know the question is going to come up like, well, I came and I didn't see speech. So let me know if you would like to come back and see speech, and we will make it happen. You didn't miss it. If you didn't miss it completely, if you missed it the first time, we'll make it work. And then, as I explained, enrolling as many individuals with Syngap gives us the most granular data so that we can move forward, which is what you guys, and what we want to happen. And then I'll give Katie a turn. Green to advance, and then red to go back.
All right. So I know I'm kind of a less familiar face to a lot of you guys in the audience today. So thanks for letting me be here and represent our new Colorado clinic as well. So what is one of kind of the biggest shared goals of us as clinicians and all of you families out there is clinical trial readiness. We want to get to the point that we are able to start doing really meaningful research and developing potential treatments to treat our patients with Syngap. So the components of clinical trial readiness, clinical outcome assessment, so having really good measures that cover multiple domains that represent all of the different challenges and symptoms that you guys face. And then being able to measure that, those aspects of the presentation and change over time. So we can see if there is a treatment or a therapy that comes into play, can we measure how that potentially impacts those different aspects of the presentation. We want to have really robust natural history data, so data that's very comprehensive as it can be. We know sometimes it's easier said than done. And ultimately having both cross-sectional and longitudinal data. One of the biggest questions that families ask us when they come to clinic is, what is this going to look like in a year, 5 years, 10 years? And we want to work to, be able to answer that question better. And then just having support. We need the support of clinics, providers across the country. So that's why we're trying to establish more clinics. And then having that community engagement. So having the patient advocacy groups that make all of these things happen, and having families meet each other, come together, just like you said. That is one of the nicest parts about clinic. Our primary goal in these clinics is first and foremost providing excellent clinical care. We have, again, multiple clinicians in one visit with, my slide just went away, who have very specific expertise in Syngap, who have worked with patients before with this condition, so that when you guys come to clinic, you don't have to be the expert for once. I know that a lot of our families, they, work with their local providers, and sometimes they're really great providers, but they're always having to educate them on what Syngap is and what it means. So the idea behind having these clinics in place is that you don't have to do that. We also provide consultative service for that primary care team back at home so that they also don't have to always feel like the experts. They have kind of a team of people to lean on to help sort of guide what that care looks like over time. The way that we structure our clinic is having that research within a clinic visit. So conducting our clinic visit in a way that we're collecting that meaningful data without having to add too many extra visits. Because again, we know it's very time consuming and it's not always the easiest thing for you guys to get to those visits. It can be challenging wrangling a kiddo for that long. So we try to be as effective as we can with that time. So performing standardized clinical assessments that allow us to, use that data in a very meaningful way. Performing neuropsychological evaluations that both gets you really quality information to share with teachers and other educators. And then those caregiver surveys that I know we keep harping on, but they are very important. They give us information that we're just not able to get within a clinic visit. We want to know what every day looks like. And then having this clinic facilitates communication between different clinics, between different clinicians across the country that are working on this condition, researchers, and of course, the families. It's really all about you guys at the end of the day. And we'll just talk a little bit about our respective clinics.
So, End Clinic, there's so many acronyms. End Clinic is basically, we see it as a clinical home for your disorder. And so it's a multi-institutional center of excellence, and it bridges the expertise from the University of Pennsylvania in collaboration with Children's Hospital of Philadelphia. So we're comprised of two really important groups, and us, speaking today and assessing your children, we are the clinical group. And then we have the translational group at Penn who works on the scientific aspect and the novel therapy, try to develop novel therapeutics to treat the disorder. And what we hope is that, and what we hope and what we expect is that the two arms of END will converge together to provide novel therapeutics and treatments and effective therapies for Syngap 1. Again, very cute kids. So recruitment at CHOP, we started the earliest. So we've seen, 91 unique individuals with Syngap 1. It's been a beautiful, wild journey. We've seen babies, we've seen, a patient in their 60s, and it's just the most lovely community. We've seen we want people to come back every 6 months. And so in the first year, we were kind of like, if you can make it back, that would be great. And now in year 2, we really want to emphasize the 6-month cadence. Again, this is another thing to put on your plate, and we feel stressed about it, but it's very important to just keep with the cadence of every 6 months. Again, this is where the additional sites will be helpful, but we've seen 28 visit 2s, and we've also had kids back for visit 3 at seven individual patients for that. So we want to continue to increase recruitment, always push recruitment, sign up new individuals, and then they can communicate with END, and if they're closer to Stanford or Colorado, then we will direct them, towards those clinics. What to know before you go. Again, being a rare parent, I know there's a Facebook group where all the dirt is shared. And so it's a long day. It is. It's truly, truly a long day. But we're pretty flexible, and I'm sure Colorado is as well, where we will do assessments where your child wants us to do assessments. We will make anything work, but bring the comfort items, bring your AAC if you have one, an iPad, a blanket, just any kind of comfort items that will help your child stay calm. And then tell us all of the medications. So, Tanganel, I know a lot of times I think families would think we can't tell them it's off label. We want to know everything that your child is on, and we are certainly not judging any of your decisions. It gives us more data, honestly, and it helps keep your child safe because we really know everything that they're on and if there's any potential interactions. And so the protocol, I won't go over this entire slide. We've all seen this slide many, many times, but it really just gives you the complete picture. And this is with STX-BP1 of the entire protocol, all of the domains we assess, all of the plans for the future biomarker analysis. And as I stated earlier, we really realized that this needs to be broken apart at this point to have 2 separate protocols. And then the recruitment, I kind of already went over this for CHOP, but Stanford is planning to start seeing patients in 2025, which is really exciting. And Colorado has evaluated 6 patients, and they're going to resume monthly clinics in January. Megan will be there. And again, just to stress, the importance of the every 6-month cadence with a buffer of about 2 to 3 weeks. There's a little bit of wiggle room, and we can work with you, of course. And so to enroll in the natural history study at CHOP, this is our email, end@chop.edu. And again, we will connect you with your closest site, but we can be a home for information and to let you know, basically by this pictures, that we will take care of you. And we will take your child on a walk. We will get you food if you need it. We're here for you as a family.
All right, I won't be too repetitive. We do share a lot of qualities, I think, in our clinics. That's the goal. But we also have this multidisciplinary clinic in Colorado that we just started in August. We have two very good reasons back there that we had to pause for a few months, but we will be starting back up again in January when Dr. Abbott gets back from maternity leave. But we also have a wide variety of providers that will see you in clinic: neurology, genetics, neuropsychology, rehab, all the therapies. activities. So we try to provide a really comprehensive visit that we can address all of the different concerns that you have. We also have a pre-clinic meeting before that clinic where we go over the specific questions that have been brought to light by our awesome clinical coordinator, Riley. So we're really thinking about you guys before, during, and after that visit. And then that's part of a larger kind of under the umbrella of a larger multidisciplinary clinic program that sees a bunch of other wonderful disorders that we love to work with. So it's also a half-day clinic. The patient kind of stays in one room for the afternoon and all the different providers filter through that room. We have a really nice multidisciplinary space that has like little play areas, things like that. So also we will kind of meet you where your child wants to be, and we will make those exams work in whatever space is the most comfortable for them. We also incorporate a 1-hour special care clinic appointment the morning of that clinic, and then a neuropsychology quality of life evaluation the day prior or the day after, depending on what works best for your travel schedule. So again, got to have a shout out to Dr. Abbott. We wouldn't have the clinic without her. We wouldn't have the clinic without SRF, and especially without all of you guys. So thanks so much for letting us come and talk to you about it.
Thank you.